India has reimposed a lockdown in parts of Tamil Nadu as coronavirus infections continue to surge. More than 13,500 new cases have been reported, the biggest single-day jump, and there have also been 336 more deaths. Chennai and 3 neighbouring districts are in lockdown till the end of the month. Only essential services are allowed to operate and strict travel restrictions are in place. And Chennai is one of the country's largest hotspots. Close to 3/4 of Tamil Nadu's confirmed infections are from the city, making it one of India's largest. Ishan Garg joins us live for more on this. So lockdowns reimposed in and around Chennai. What exactly are the restrictions, Ishan?
The restrictions in Chennai are largely around freedom of movement. So now the city has propped up close to 300 checkpoints to make sure that people are not traveling more than 2 kilometers from their homes. And on top of that, only emergency services, only essential services will be allowed to operate in the city. But having said that, all the essential services like shops or telecom providers or medicine and pharmacies, they will also work from 8 a.m. in the morning to 2 p.m. in the afternoon, and they will be shut for the remainder of the day. And on Saturday and Sunday, that is for the next few days, for the next 2 days, they will be completely shut. On top of that, the city has advised that all autos, all cab services, all of these small public transport options will be discontinued. And on top of that, the city of Chennai has deployed vast amounts of police. There's heavy security presence around the city inside, particularly the areas which are heavily residentials, to make sure that people are not getting out of their houses if it's absolutely necessary. And some people are calling the restrictions imposed in the city of Chennai far too severe, even more than those that the federal government announced back in March when the entire country went into the lockdown. And because of this, we are seeing huge number of people trying to leave Chennai in the past 2 days. We saw long queues at the bus station, long queues at the train station, and even at the airports, because people think that going into such a severe lockdown in Chennai is not their cup of tea, and they would much rather leave Chennai and go back to their hometowns because a large number of these people are actually migrants who work in Chennai.
So, Ishan, some very significant movement restrictions in Chennai, but it's the only city in India to reimpose a lockdown. But coronavirus infections elsewhere, they've been surging. So why aren't more places being isolated now?
Now, while there is no federal directive to isolate more cities, and experts have been saying that cities like Delhi and Mumbai and Bangalore, which are also as highly populated as Chennai and have a very high viral density as well, they should be isolated. But the process of isolating or sealing borders of at least larger cities, it seems like it has been delegated down to the state governments and all the way down to the local government, the municipal governments, and the local governments in towns and villages. And now they are sort of responsible for closing borders if they feel the need to. We have seen a trend emerge since India opened for business, the economy reopened in a phased manner since June 8th, that the federal government decided not to make a blanket policy for the entire nation. And we might see more of this going forward. And just to give another example of this, we've also seen the same practice as Chennai emerge in Delhi as well. Delhi has also sealed parts of its borders with a different state, and that's been done by the order of the local government. So while there is no federal guideline on sealing cities, we might see more of this going forward. And what we have understood from Prime Minister Modi's meetings that he's been having with state chief ministers for the past 2 to 3 days, there must be some deliberation, some debate going on how to do this more effectively so that cases of COVID-19 are at least contained in larger cities where the healthcare infrastructure is good and they cannot leak to other towns and villages.
Ishan, thank you very much for that. That was Ishan Garg there on India's COVID-19 situation.